Some of the most newest advances relate to the use of implantable devices for pain management. Spinal cord stimulation has been out for decades now, but we've had really tremendous advances in the use of stimulation. In addition to spinal cord stimulation, we now have peripheral nerve stimulators, and the software that drives these devices has improved dramatically over the last 5 years. So what we have now, as I mentioned, we now have the ability to implant peripheral nerve stimulators where we can target the specific nerve that might be causing the pain. We have a number of medications in the pipeline. Over the last 5 years or so, we haven't seen that many newer medications, but we've heard buzz that there are a number of newer medications that are in the pipeline. One of the most important changes over the last several years has been a change in the formulation of these medications. For example, one of our medications now comes in granules, so that if taken appropriately or taken as intended, really you only get the active pain medication. But if you attempt to alter the medication, an antagonist or a medication that basically blocks the effect for which someone might want to abuse the medication, that medication gets released in conjunction, so essentially the medication has no effect. And that minimizes the desire to misuse the medication. All of these medications are on the market now, and what we're seeing is for some insurance companies, they're actually the preferred medication in the class. They're expensive, but they're also covered by the prescription plan, so the cost to the patient actually is not that much more than the original medication.